Hey, so all today we will discuss about the topic that is called vitamins. Okay, so let's begin with this. Basically, this can come for your theory for 5 marks. Either of the vitamin you can be asked to write about. So basically, we have two categories of the vitamins. Basically, they are either fat soluble or they are either water soluble. Okay, we have basically the four fat soluble vitamins, that is vitamin A, vitamin D, vitamin E, and vitamin K. And for the water soluble, we have vitamin B and the vitamin C. Okay, and you should remember that for the absorption of the fat soluble vitamins, we require the bile salts. Okay, so you should remember very well, and it's get sometimes very confusing for all of us. We during the viva it is also about the fat soluble vitamin. Sometimes we do a silly mistake, we tell the water soluble one or the fat one. So please remember it very carefully. Okay, now as all of you know that the vitamin A is basically for good for the eyes, that is from the carrot for the vision. The vitamin D is called the sunshine vitamin, that is from the sunlight. The vitamin E is basically for our to prevent our aging. It is also the anti-sterility vitamin, and vitamin K is important for the clotting. Okay, and the vitamin B and the vitamin C are further. Vitamin C also called as ascorbic acid, and vitamin B, there are different types of vitamin from vitamin B1 to vitamin B12. We will discuss all of them in this video. Okay, or either in the next part. So first of all, let's begin with our fat soluble vitamins. Before beginning with fat soluble vitamins, you should know about the dietary constitution that you should give. Okay, I am writing down here. This is vitamin A, vitamin D, vitamin E, or vitamin K. Okay, how much amount of each of these vitamin we should need in our body? The vitamin A we require is 750 microgram. Okay, the vitamin D is 5 microgram, the vitamin E is 10 milligram, and vitamin K is 5200 microgram. Please remember, don't confuse the term milligram with microgram. Please, let's focus again. Vitamin A we have to require is 750 microgram, vitamin D is 5 microgram, vitamin E is 10 milligram, and vitamin K is 5200 microgram. Or sometimes we will also get to know in vitamin A in the form of retinols. We can give 900 to 1000 retinols. Okay. So this was the composition of the fat soluble vitamins. Okay. So firstly we will begin with fat soluble. When we will study about the water soluble, then only I will tell you about their composition, how much of the water soluble vitamins we require in our body. So let's start with the very first, that is vitamin A. Okay, as all of us know something about the vitamin A, as we have studied in our small classes. Okay, so first of all we know that vitamin A is very good for our eyes. Okay, we can get the source from the carrots. All of us know that. First of all, its pro vitamin form is beta carotene. Okay, basically it's absorbed in intestine and it is stored in liver in the form of retinol palmitate. You should remember, that is retinol palmitate. Okay, basically the provitamin form is the beta carotene form. It is absorbed in the intestine and stored in the liver in the form of retinol palmitate. Okay, then what happens is that the earliest symptom when there is a deficiency of vitamin E. What is the earliest symptom of deficiency of the vitamin B? It can cause the night blindness or called nyctalpia. Okay, Then what is the first clinical sign? Symptom is night blindness and sign is basically the conjunctival xerosis. Okay. When there is a severe vitamin A deficiency, then there will be xerophthalmia along with triangular area that are called Bitot spots. Okay. If this condition, that is the xerophthalmia, persists for long, when there is a vitamin A deficiency for the long period of the time, then we can have the keratomalacia. Okay. If xerophthalmia persists for longer period, then we will have the keratomalacia. Okay, please remember these features very well. The earliest symptom is night blindness, but the earliest sign, that is the conjunctival xerosis. If there is a severe deficiency, it can cause xerophthalmia with Bitot spots, but when this xerophthalmia persists for a longer period of time, it can cause keratomalacia. That is the more dangerous form of it. Okay, so basically this vitamin A, let me write down here. Vitamin A will destroy the lysosomes. Okay, and basically vitamin A can be inhibited with the help of citrol, that is the orange peel lemon oil. Okay, so there is a cycle that is associated with vitamin A. All of you will have studied this somewhere in your books or in the class, that is called as Wald's visual cycle. Before starting with the Wald's visual cycle, we should know that in our eyes we have something called as rods and something called as cones. Rods and cones. Both rods and cones have different functions, as it sometimes gets very confusing which is associated with color and which helps us to see. Remember, as the name, cone starting from C, so it helps to visualize a color, and rods basically help us to see in the dim light. Okay, as for see or view in dim light. So this funda should be clear. What is the function of rods and what is the function of cones? Basically what happens is that in retina we have rhodopsin. Okay, rhodopsin is the pigment that is present in our eye. So whenever we are exposed to light, what happens, this rhodopsin will convert into 11 cis retinol along with opsin. Please break into two. That is, rhodopsin will break into 11 cis retinol and that the opsin. Okay, it will break into these two parts. Then what will happen further, there will be the division like 11 cis retinol and all trans retinol. Okay, it will divide into two like 11 cis retinol and all trans retinol. Basically what happens is that when all trans retinol wants to convert back to cis retinol, it can be done with the help of enzyme, that is isomerase. Then there will be three barriers. First of all, there will be the epithelium of the retina, then there will be the blood, and then it will enter into the liver. Then entering into the liver, all trans retinol will convert into trans retinol with the help of enzyme alcohol dehydrogenase, and then this trans retinol will convert back to cis retinol with the same enzyme, that is isomerase, and this cis retinol will then convert to cis-retinal with the help of enzyme same, that is alcohol dehydrogenase, and then it will convert back to 11 cis-retinol. This conversion basically occurs. First of all, there will be the retinal epithelium, okay, then will be the blood, and then will be the liver, okay. So you should remember that there are two photoreceptors present in our eye, that are rods as well as cones, okay. Cones are for that of the color, and rods basically help us to view in dim light, okay. So whenever we go to the light, in the retina we have a pigment that is called rhodopsin. It will break into 11 cis retinol and that of the opsin, and further this will divide into two, that is 11 cis retinol and all trans retinol. All trans retinol, after crossing the retinal epithelium and the blood, it will enter into the liver in the form of trans retinol with the help of enzyme ADH, and this trans retinol will convert into cis retinol with the help of isomerase, and then cis retinol will convert into cis retinal with the help of alcohol dehydrogenase, and then back to 11 cis retinol. That you should remember, okay. Basically what happens that when we go into the sunlight and then to the dark room, we will not be able to visualize anything. That thing is called the dark adaptation time. After some time we will be able to see everything, but for few seconds we find everything black. This difference from going to the sunlight and not visualizing anything in the dark room, that is called as the dark adaptation time. Let me write down here. I am mentioning it down. That is dark adaptation time, okay. So there are basically some conditions that are, so basically you should remember what are the terms that are associated with vitamin A. It can either be Bitot spot, it can either be that of xerophthalmia, it can either be conjunctival xerosis, it can either be night blindness, or it can either be vascularization of the cornea, okay. So what happens when there will be the toxicity of vitamin A? Let me write down here. When there will be the vitamin A toxicity due to the certain amount of overdose, there will be the weight loss of the patient, okay. There will be certain amount of joint pain, there will be hepatosplenomegaly, enlargement of liver as well as the spleen, there will be skeletal calcifications and dermatitis, that is the inflammation of the skin, okay. So basically you should remember the weight loss is most common when there is a increased toxicity of that of the vitamin A, that you should remember. And in the earlier part I have mentioned that the provitamin form, it is called beta carotene. Basically they have the beta alanine ring, okay. And most importantly, one molecule of beta carotene can give rise to two molecules of vitamin A, okay. So this was all about the vitamin A. It should be given up to 750 microgram. Provitamin form of it is the beta carotene form, and they have the beta iron ring. So one molecule of the beta iron carotene can give the two molecule of vitamin A. What is the earliest symptom of it is night blindness. What is the earliest sign? You should learn the difference about the signs and symptoms. Symptom will be night blindness and sign will be conjunctival xerosis. And in the case of severe deficiency, there will be xerophthalmia. If xerophthalmia persists for the longer period of time, there will be keratomalacia, okay. It will destroy, vitamin A will destroy our lysosomes. Then we have learned about the photoreceptors in the eye, that we have the rods and the cones. And in the case of vitamin A, we have something called as Wald's visual cycle, okay. Then the most adverse effect of the toxicity of the vitamin A is the weight loss, okay. And there is something called dark adaptation time, that is when we are outside in the presence of sunlight, and when we come to the room, we are not able to see or visualize the structures, for the some period of time, but after a certain period of time we can see, so this duration from going into the sunlight and not visualizing anything in the room, that is called the dark adaptation time. So this was all about vitamin A. In the next we will cover about vitamin D, vitamin E and vitamin K. If you find this video